So today here in Makueni, we came to meet with the youth groups just to be able to organize them to be able to participate effectively in the county processes, especially in the budget making processes, so that they are able to have effective influencing of the budgeting, and in this process there are issues, there are priorities that have been identified by young people and persons living with NCDs, and we are hoping that when they effectively participate, then they will be able to influence budget allocation, especially during the upcoming public participation processes. We are also aware on that the next CIDP process is just about to start, maybe the next 1 year. So when these youth groups are organized, especially by persons, amongst them are persons living with NCDs, then we'll have stronger participation, and in the next CIDP of Makueni County, we'll be able to see more prioritization in the CIDP and therefore budget allocation. We've been working also closely with the Makueni County in terms of mapping out persons living with NCDs, developing NCD support group through the health promotion office, and we are hoping that through this kind of collaboration, then we'll see a bit of more of attention being given in terms of prevention and control of NCD in the counties. Yeah, otherwise we all call upon all the stakeholders so that they can also help us into this journey. We know that the burden of NCDs in Kenya right now supersede the burden of communicable disease, especially in terms of the health facility and also in terms of the drugs and other requirements that are needed for to sustain this burden. So we call all stakeholders to be able to help us and join hands towards this cause. And we also call the county government so that they can also provide more. The coming of COVID-19 has really impacted quite negatively on the health of persons living with NCDs in a number of ways. One, there has been fear in terms of persons living with NCDs leaving their houses to go and access healthcare in health facilities for the purpose that they would be able to contract COVID-19. And we have also been aware that the persons living with NCDs are more vulnerable, especially when they get COVID-19. And this has created a lot of fear. Together, we are also aware that some of the persons living with NCDs have now not been able to go to job and therefore they have been able to lose livelihood, and they are not able to buy the drugs. And even their own caregivers, some of them are now facing double burden because then they have to take more responsibility in terms of looking for the livelihood and also taking care of persons living with NCDs. At certain instances in the interviews or a number of interactions that we've had with the persons living with NCDs, especially at the county levels, there are certain basic NCD drugs that they have not been able to get. And this makes them more vulnerable because then they are now not adhering to their regimens and therefore even threatening their lives. So we are also asking that we should be able to take this into account, and especially when the counties is procuring the drugs, then they should prioritize also procuring the drugs of of NCDs so that they are readily available at the county level, and then they are also available to places where they can also the health facilities where they can easily be accessed.